I have good news for you. If you've been diagnosed with a mental illness is actually one of the most treatable forms of medical problems. We think of broken bones and we think of infections as, well, you get it fixed and all that. But it turns out that some of the most treatable conditions are actually mood and anxiety conditions. More than 90% of people with pretty severe anxiety problems can be helped very substantially. And it's a similar situation for people with depression. What remains, however, is a vulnerability to having another flare-up. So treatment can really help you in the acute stage, get symptoms under control, get your functioning back. But what remains is a vulnerability. But the good news about the vulnerability is we usually know what the vulnerability factors are, like what would trigger another episode. So when we think about depression, we know that persistent problems in thinking, if you have a kind of permanent way of being pessimistic, that actually makes you more vulnerable to having another flare-up of depression. So apart from the psychotherapy that you might have to fix the acute depression, there's another form of psychotherapy known as mindfulness-based cognitive behavior therapy that helps fix chronic negative thinking when you're already feeling well, and that has been shown to prevent a new flare-up of depression. And what's good about that is you learn those skills, you learn those ways to think differently, and the therapy, when it's finished, since you've learned something, it stays with you for years. Medications are great, but the bad news about medication is when you stop, when the medicine's not there, it doesn't have the opportunity to persist in helping you for years later. So to conclude, mental illness is very treatable. It can flare up, and there are things you can do to not only treat the acute illness, but treat the vulnerability factors and prevent a new flare-up. Now, will you always have a label of having mental illness or something? Of course not. Just because you broke your leg once, you don't walk around with a chronic condition. Well, I'm Mr. Broken Leg or whatever. However, just like a broken leg might leave you sometimes with a vulnerability to weakness in bones and all that, having had an episode of psychiatric illness does leave you with a vulnerability to get ill again. But if you've had a good course of treatment, you're done with it for a good portion of time.